Alzheimer's that could lead to earlier detection of the disease. Joining us now to discuss it is News Channel 5's medical specialist, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you so much for coming in today.
You're welcome. Good to see you, Keely.
It's always good to see you, too. Well, our first question about this study. With the new Alzheimer's guidelines, how will they be able to determine earlier that you may be developing it?
Yeah, well, Alzheimer's is a nasty disease. I mean, it's terrible because in many ways. Number one is a brain disease that's progressive, and it causes gradual memory loss as well as the impairment or the inability to take care of yourself. 30 million people have it worldwide, and over $600 billion are spent on it yearly to take care of these people. So it's very important for us to figure this out. Now, what do we do? Well, the reality is that there is no cure right now, okay? But early detection can include brain scans, cerebrospinal fluid analysis, and there's other biomarkers as well that we can tell. But some might say, well, what's the point if there's no cure? Well, the reality is that there are medications that can prevent the progression of the disease, so that's number one, but also more important, and that is that it helps facilitate research and potentially a cure in the future, which is obviously important to all of us.
Now, this next question is somewhat related to that subject. Can high blood pressure affect brain activity?
Well, it can, and it does in this way. And the fact is that the brain is a sensitive tissue, just like most other tissue in the body. It requires the nourishment from the blood. And what happens after years of hypertension is it beats on those arteries. It can cause atherosclerosis, plaques, and blood clots. And what that can do in turn, cause mini strokes, or disruption of blood flow to the brain. And then, of course, also cognitive impairment and or vascular dementia. And that's from years of poor blood flow to the tissue in the brain. The good news is that if your blood pressure is well controlled, then your risk is almost as low as people without blood pressure. So make sure you maintain it.
And I think sometimes people forget that high blood pressure is your blood is trying to work harder, and your heart is pumping harder to try to force your blood throughout the rest of your body.
That's exactly right. And so it's that wear and tear on the vessels after years and years really takes its toll. So it's so important because it can lead to so many complications if it goes untreated.
All right. Thank you, Dr. Soria. I always feel smarter when you come.
Oh, thank you.
Thank you for being here. Well, if you have a question for Dr. Soria and you want to feel smarter, you can send it in by going to our website, WPTV.com, and clicking on the help link. Scroll down on the right-hand side, and you'll see a form to write in your question. Thank you once again for coming in, and we'll see you next week.
You betcha. Thank you.